We have a conversation now with Josh Jardine. He's with the Star Valley Hospital, Star Valley Medical Center Infusion Center, registered nurse, infusion specialist. Josh, thank you for joining us.
Thank you.
Well, tell us about your position overall. You're in a unique position here where you've got, 4 or 5 different workstations where you help patients. In the infusion center, we're somewhat familiar with that term, but explain what you do.
So with infusions, we do infusions and injections. We do things to help for chemotherapy. We do, if you're dehydrated, we take care of dehydration. IV antibiotics, those are 3 of the main things we do. We also do some intravenous iron.
We're with Josh Jardine. He's with the Star Valley Infusion Center, Star Valley Medical Center Infusion Center. But Josh, this takes special training when you're talking about these items. This is something you just don't do as a registered nurse. Tell us about it.
So yeah, you have to take some extra classes to become chemo certified, and it takes different amounts of time, but usually takes about 2 to 4 months. It's pretty in-depth training, and especially with chemo, there's a lot of extra things and a lot of really things that you really have to pay attention to.
This is something that takes several hours in some cases. How do you work with the patient, help them relax, help them come into the infusion center and have their treatment in a relaxed atmosphere?
So I like to have it be, for me, it's all about the patient. It's all about making you relax. It's all about making you comfortable. We have some snacks over here. We've got some drinks. I try and get to know the patient. I try and connect with them the best that I can.
Help them through a difficult time in their lives. What can they expect when they come into the infusion center, whether it's for a chemo treatment or something else? Just walk them through their experience here. Just tell us about that.
Okay, so I just check them in here. We sign all the paperwork. We go through all that. I get a set of vital signs while we chat, and then we just get started. I try to get kind of their backstory, what's going on, and then we just get it going. And
do you work with the physicians, the specialists? Where do you tie in with that?
So we work very closely with all the physicians. A lot of the patients come from or have the doctors in Idaho Falls or Utah. We work with the physicians there too, and then we work very closely with the physicians here, just to provide the highest quality care that we can for these patients.
All right, and recap again what you do at the Star Valley Medical Center Infusion Center, what the center's all about, and what you do specifically. A recap.
So we take care of patients that typically are sick but not sick enough to be in the hospital, something that you can treat kind of in an outpatient setting. You come in, we take care of you, and then you go home.
All right, very good. Josh Jardine, registered nurse, infusion specialist, Star Valley Medical Center Infusion Center.